so happy to have each of you join us today for the Weathering the Heat, Wildfire Smoke and Heat Tools for Healthcare Professionals. My name is Emily Noodleman, and I'm the Director of Implementation and Outreach at the Bree Collaborative.
And good morning. I'm Heidi Steves. I'm the Director of Admin SIP at the Foundation, and I was working with our intern Carolyn Graham this summer on this material. So happy to share that with everyone here.
We are so excited to have each of you join us as we share this new resource Carolyn led in the development. We just want to highlight that in February 2025, so earlier in this year, the Bree Collaborative published a report on the health impacts of extreme heat and wildfire smoke. It detailed different actions healthcare sectors can take to improve healthcare around the topic for patients. So, for example, what clinicians can do, what clinics can do, what Department of Health can do, among others. This summer, though, as we were saying, the Bree Collaborative was really fortunate enough to host an NPH graduate student from the University of Washington to create a toolkit to support our report. In the webinar today, we'll review this toolkit and the different resources in it, which we've titled the Heat and Wildfire Toolkit for Healthcare Professionals. You can see that we are recording this presentation, and we intend to post it on our website within 1 week of this event. We will send the recording and the published toolkit to those who signed up for the event, so you may access it then, and we'll also share the link today for those who are on the call. For the event today, you'll hear from our speaker and then have the opportunity to ask some questions. If you have any questions, please place them in the Q&A box at the bottom of your screen. With that, we will welcome Carolyn to start presenting.
Thank you, Emily. Hi, everyone. My name is Carolyn Graham. I am a Master of Public Health student in the Department of Epidemiology at the University of Washington, and I have been working with the Foundation for Healthcare Quality and the Bree Collaborative this summer to create a toolkit for healthcare professionals on the topic of extreme heat and wildfire smoke. Thank you all for joining us today to learn more about it. I'm going to start by giving a quick overview of why the topics in the toolkit are important for healthcare professionals. Extreme heat is an important topic because, similar to the flu, it is a seasonal health risk with seasonal heat waves that can cause heat illness and, in some cases, death. Importantly, the heat wave season has been getting longer and hotter with climate change, and heat deaths have been increasing. Next slide. Similarly, wildfire smoke is another seasonal health risk that has been worsening with climate change, with people across the US now exposed to more wildfire smoke pollution as wildfire seasons worsen. The toolkit we'll be talking about today focuses on both heat and wildfire smoke because the two are often very connected. Not only do wildfire events and extreme heat events often overlap, but higher air temperatures increase wildfire likelihood, which presents a serious risk for human health. Since wildfire smoke exposure increases all-cause mortality, impacts respiratory health, and wildfire smoke and heat may even interact to impact cardiorespiratory morbidity and mortality. Next slide. To address the health risk from extreme heat and wildfire smoke, the Bree Collaborative released a report earlier this year, as Emily mentioned, on these topics, and they wanted to create implementation tools and educational resources that promote adoption of those Bree Report guidelines. We wanted a concise and easy to use toolkit for healthcare professionals to support patients and clients in preparing for extreme heat and wildfire events, with the goal of kind of preparing for and mitigating the associated harms to health. To create the toolkit, I sorted through the resources and information referenced in the Bree Report, which come from a range of different regional and national health departments and other organizations. And I organized the tools and resources in a way where hopefully healthcare professionals can follow along with the provided workflows and use the toolkit to access whatever tools they need for themselves or their patients. In the process, I received feedback from various healthcare professionals on the order of presentation for the tools and on what features would be most helpful for improving usability. To use the toolkit, I recommend starting with the toolkit orientation document, which will be available on the website as well. For now, a quick overview of how we recommend that you use it is to begin with reviewing the toolkit contents ahead of time to see what's in it. Then adapting the toolkit as needed for your role. That may mean pulling out some materials that you think will be really helpful for you or adding in your own. And then sharing materials with patients during visits and afterwards in the form of patient handouts, many of which could be the included handouts attached to an after visit summary or as a link. As a quick note, the toolkit contains a lot of preview images of different handouts and documents, where to access the whole document, you click on the image and it takes you to a web page where the whole document will be available. Once you dive into the toolkit, you can see that it's organized into the following sections within the table of contents. After the introductory materials and some checklists, there are educational resources for healthcare professionals, and then a section where the bulk of the tools are found for the during patient care section, which is mostly what we will be reviewing today. And then there are additional resources for after patient care, as well as additional resources for other healthcare roles, since the toolkit is predominantly targeted towards primary care providers, though the materials are intended to be potentially used by a whole range of healthcare roles. We opted to separate most of the toolkit into two sections, one for wildfire smoke and one for heat, since there may be times where only one is relevant, and this way that information can be easily accessed all at once. Both the wildfire smoke and heat sections are organized according to a workflow, like the one you see here on the right. This is intended as a guide to the organization of tools throughout the toolkit, and it provides an example workflow for walking through these topics with patients during a visit. When viewing the toolkit PDF, the different steps of the workflow can actually be clicked on, which will take you directly to the relevant section of the toolkit. So for example, if you wanted to access information about action plans for heat, you would click on the box that says action/care plans for heat, and you would be taken right to those tools within the toolkit. Now, to get an idea for what tools are available, we are going to walk through the workflow for extreme heat. There is a very similar workflow for wildfire smoke, as well as similar materials available, but we won't have time to review those today, though we will include a few examples from that wildfire smoke section. Both sections are divided into tools for healthcare professionals and then tools that are more geared towards being shared directly with patients. The first step in the workflow is to assess a patient's risk for heat illness. For this, we have included this tool. It's a CDC questionnaire to assess heat risk factors. And then there is a section providing information on how to communicate with patients about heat, which includes links to other toolkits that have been created on this topic, such as the World Health Organization Communicating on Climate Change and Health Toolkit, this toolkit on health literacy, universal precautions, and the Harvard Chan Sea Change and AmeriCare's Climate Resilience for Frontline Clinics toolkit, which is incorporated many times throughout our toolkit. The next step in the workflow is to review heat-related illness signs and symptoms. Shown here is a document from the Northwest Healthcare Response Network for healthcare professionals to use. And now there are patient resources. This is the next section, is resources to educate patients on extreme heat. And for this section, we have included a handout from the Washington State Department of Health for heat illness symptoms, and it's similar to the handout in the provider section, but it is more patient-facing. We also include resources for both patients and healthcare professionals on how to use the National Weather Service heat risk tool to check the heat risk for their location on a given day, and with a note that patients might be more likely to use apps such as the Weather Channel or Weather app. Similarly, in the wildfire smoke section, we have links to these resources for patients as well as for providers to monitor air quality. And this handout, again, from the Washington State Department of Health, that includes a link to monitor air quality along with guidelines for what different levels of air quality mean and how activities can be adapted to those different levels. Then the workflow and the toolkit transition into proactive steps that can be taken to prevent heat illness. This section includes handouts from the Washington Department of Health and the Pacific Northwest Agricultural Safety and Health Center on how to keep cool on hot days. And to provide another example from the wildfire smoke section, the toolkit has an air filter section that provides resources for selecting an air filter, instructions from the University of Washington Edge Center on how to make your own DIY air filter, and information on programs for individuals with greater need to access air filters. Going back to the heat section, there are additional resources such as these handouts from the CDC and the Pacific Northwest Agricultural Safety and Health Center that apply to specific health conditions and specific populations, such as children and teens with asthma, people with heart disease, pregnant women, and agricultural workers. I think the next slide. There's also a section, two sections actually, one back in the provider section, but on medications and heat, both for providers and for patients, because the storage or effect of some medications can be impacted by heat, and some medications can put patients at a greater risk of heat illness. So these sections include information on what those medications are that may interact with heat in some way. And from that Climate Resilience for Frontline Clinics toolkit, there is an info and planning sheet for providers to share with patients for them to know what medication considerations and adjustments they might need to keep in mind on hot days. Finally, to tie everything back together, there is a section on action plans containing example templates from that Climate Resilience toolkit that provides a way to incorporate a lot of the information shared throughout the toolkit into an actionable sort of care plan that can be shared with patients for use in times of extreme heat. And there is a comparable plan for wildfire smoke for the same purpose. The toolkit has many other tools, such as different tools that might be specific to other healthcare roles. And we won't have time to review those today, but hopefully overall this was a helpful overview of how the toolkit can be used to help prevent the health impacts of extreme heat and wildfire smoke. Thank you.
Thanks, Carolyn. I'm going to show too where is the toolkit, and I'm going to post the link to everybody in the chat right now. We uploaded it on our website this morning, and so you can access it. This is the Bree Collaborative's website. Under our implementation tab, you can see there's the Heat and Wildfire Toolkit for Healthcare Professionals. And when you click on that, it will load. My computer would like to behave. So this is the toolkit that we are reviewing. It is open to anyone who would like to access it. These are the different workflows that Carolyn was detailing in her presentation today that we find that are hoping they're really helpful for all of you, just to kind of have a succinct area of what to do when something comes up and somebody walks into your area that you're working at. So this is on our website, can be utilized by anybody or accessible, hopefully, to everyone. You've also saw too in Carolyn's presentation, we are really focusing on Washington State. Why is that? The Bree Collaborative is centered in Washington State and is developed through the Washington State legislation. So we keep in mind our Washingtonians in our design. However, we do hope other states and other organizations feel they can use our material. So that's why you may have seen some information from the Washington DOH, for example, among others that kind of inform to this. But when you open up the toolkit, you'll see this workflow that Carolyn was mentioning. You'll also see the heat workflow. And when you need anything specific, you can click on that little box that you find that you fall onto, and it will bring you to the area of the toolkit that you were seeking that information. So we're hoping this is a little bit more digestible and easy to use for everyone. We are happy to answer any questions, any comments that others might have. If you have any, please place them into the Q&A box at the bottom of your screen. But as we wait for questions to come in, Carolyn, could you answer what was something that you learned and surprised you in the development of this toolkit?
Yeah, I think I was mostly just surprised by how many tools there are out there. Just if you take the time to find them, they're difficult to find sometimes, but there really are so many useful toolkits that have already been created and different handouts from different organizations.
What is something that surprised you the most though through this that you think is an opportunity for improvement in the future as we are navigating the space? And we heard that there are a lot of toolkits, but it's still hard to find the right tools at the end of the day.
Yeah, I think there were some things that I think it would be great in the future if there were like a centralized way to request air filters, or if information on days where there is extreme heat or on air quality was more easily accessible on weather apps that more people will be typically using. I think those would be great improvements for this area.
What are you most proud of in the development of this toolkit?
I really enjoy creating those workflows and setting it up so that hopefully the information can be really easily found within this toolkit, by just starting from the workflow and then having those quick links to everything.
Yeah. I know you mentioned this in your presentation, so I just want to reiterate it and highlight it. Something where this toolkit deviates a little bit from our Bree report is our Bree report is on extreme heat and wildfire smoke, and the information is mostly together in that report. We heard through feedback that Carolyn received that our audience was hoping for this toolkit to be a little bit more user-friendly to separate extreme heat and wildfire smoke from one another. So that is why you see the two different workflows and the different information. We noticed that, at least in our state, that when an extreme heat event occurs, wildfire smoke is typically commonly co-occurring with it. However, we recognize that you can have one or the other. Or you may have some patient populations that have a priority concern over extreme heat with wildfire smoke. So we hope you can educate on both of them. However, just with the feedback we received is why they are separated in the report.
Well, thank you, Carolyn, for all of the work here. I think we've gotten some comments from the audience about the practical applications of this work. And I think we touched on a little bit that there were others besides primary care clinicians who would maybe find this information useful. We mentioned in the toolkit, emergency room staff, urgent care staff, also those who are working more in the public health space. And then also, I think one of the other options is really sharing these resources at that community level. I think the things that you pulled together are, accessible to anyone with a smartphone. So I think there's a lot of things. You kind of touched on opportunities to move forward when you were saying that having more public information available. What does that look like to you? Is that a push? So what are the things that you think that other people should be aware of or telling their patients or clients to do around making sure that they know what they need to know when they need to know it around either heat or wildfire smoke?
I think one thing I was mentioning is kind of more at the systems level. If there for more of a change, a push for like the weather apps to alert people really quickly to like extreme heat events. And I've been seeing that on my own weather app this week for Washington. But also for air quality, I think there tends to be sometimes a bit of a delay before that information gets to a weather app. And so if that information were more incorporated, I think that would be a great shift so that people know kind of when the air quality might be dangerous, and maybe if then they can access materials on what to do, how to interpret that information. I think that would be great.
Carolyn, there's a question that came in that is, what is the biggest takeaway you would recommend for those who work in leadership in delivery systems from the toolkit?
I can think of something, Carolyn, if you want me to jump in and help out on this one
Yeah,
too.
that would be great.
I think one of the things that we tried to do was to make a tool that was easy for primary care clinicians to use, but even as simple as this workflow is, it's still going to take time, which means that it's maybe an additional element to an existing visit that needs to happen for some of these patients. So I think from a delivery system standpoint, just understanding that in times when we're experiencing extreme heat or wildfire smoke, that there's going to be a need for clinicians to maybe take an additional amount of time to cover this, or for pharmacists to be prepared to answer questions around dosing changes or storage needs for prescriptions during extreme heat and wildfire smoke. So I think those are the things that from a systems perspective, to understand that there might be a real, on the ground impact of these events for patients to be able to get the information that they need from their clinicians.
I would just second what Heidi's saying and just adding to that, ensuring that the clinicians and just the healthcare professional staff feel like they have some knowledge on what to talk about with their patients and clients when these concerns arise, and that they feel like they have some information where some of the material, as Carolyn was reviewing, is what do you need to know as a healthcare professional, and then the shift of what do you need to tell your patient. And so I think the first would be you as the professional need to know. And so ensuring that your staff feels like they are aware and have some knowledge piece and are being alerted when an event is on it, they're being alerted when an event may be occurring or could be occurring soon would be great, so they can start having some time to process and learn before their patients arrive, or to notify the patients in advance, which would be a little bit more future thinking, but that would be also kind of. There's a question that came in too that says, are we planning to have this kit available in other languages like Spanish? Unfortunately, we don't have a plan to do that at this time due to capacity. However, there are resources, and Carolyn can speak to this, that are linked in Spanish in the report. Is that correct?
Yeah, there are, I would say maybe most of the resources that are linked, there is a Spanish version available, either linked in the toolkit or from the website that the link comes from.
And Carolyn, one last question for you is, or sorry, actually one just came in. Can you talk about how does the toolkit clarify shared responsibility and collaboration between healthcare professionals, like the role of a primary care provider, pharmacist, community health worker?
Yeah, so there are different sections for different types of healthcare professionals that explain more about like what the role might be of a specific healthcare professional. And I think our goal was to get the information out to as many different types of healthcare professionals as possible, so that perhaps if one professional does not have time to review this information with a patient, then that patient might get the information elsewhere. And so I think the goal is that as many people have it and can share that information as possible, the better.
And as we are kind of reaching our time, Carolyn, what is one action you hope somebody can take by utilizing this toolkit?
Yeah, I think the biggest thing I would hope for is that some healthcare professional in working with a patient can quickly find and share information with that patient on how to protect themselves in the event of an extreme heat or wildfire smoke event.
Great. Well, we are hearing some really great messages coming in that says this looks really amazing and they appreciate how you have integrated different resources, especially somebody who shares this regularly. So they kind of appreciate your thoughtful approach. And we are so grateful for your work in creating this and are excited to share it with our network. We want to thank everybody for attending this event today. We hope you can join us for some events we have in the future. I will send them out, but I'll put them the links in the chat if you would like to join us. We have some events on on older adult health and aging populations, behavioral health. Our sister program has the Northwest Patient Safety Conference coming up, and we actually have a Health and Action Summit. And with that one, it will be a morning virtual and some CME available for that. But we want to thank everybody for joining us today. And also, we really want to again thank Carolyn for all your hard work in creating this. We are really grateful for it and grateful for your time. Thanks, everybody.
Thanks all.